Welcome back to Scan360. Today we are diving into one of the most essential radiology topics, understanding the normal MRI anatomy of the brain on T1 and T2 sequences. Here we can see this is the T1 weighted axial sequence and this is a T2 weighted sagittal sequence. In this sequence we will talk about the normal structures, because if we understand the normal structures, then pathology will be clear to us. Here this one is the T1 weighted. As we can see, this is the lateral ventricle and ventricle contains CSF. The CSF is black here, and here we can see within the lateral ventricles the CSF are bright here. So this one is the T2 sequence. First of all, we will look at the normal structures of the brain. This one is the cerebral hemispheres. We can see this is the left cerebral hemisphere, this is the right cerebral hemisphere, and in between these two cerebral hemisphere, this is the falx cerebri. And we can see within the cerebral hemisphere, the inside there is the white matter and the outer part is the gray matter. Now the ventricular system, there are 4 ventricles in the brain. This is the lateral ventricle, this is the frontal horn of lateral ventricle, and this is the body of lateral ventricle, and there are some other 2 horns of this lateral ventricle, that is temporal horn. Here we can see this is the temporal horn of lateral ventricle, and this is the occipital horn of lateral ventricle. Here we can see this is the 3rd ventricle, and lateral ventricle is connected with the 3rd ventricle by foramen of Monro. Here we can see this is the foramen of Monro, and 3rd ventricle, again 3rd ventricle is connected with the 4th ventricle by aqueduct of Sylvius. Here we can see this is the aqueduct of Sylvius. Now basal ganglia region, here we can see this is the head of the caudate nucleus, and there is, in this part there is globus pallidus, and laterally there is putamen, and thalamus is located in this part. Here you can see this is the thalamus. Now structures of the brainstem. In this sagittal T2 we can see this is the midbrain, this is the pons, and this is the medulla. Now come to the cerebellum. Here we can see this is the cerebellum. It has 2 hemispheres, cerebellar hemispheres. These 2 are divided by falx cerebelli here. Within the cerebellum we can see this is the 4th ventricle. Here this part is the pons. You can see this is the pons, and below it this one is the medulla. Now come to the white matter tracts. This is the corpus callosum, which connects 2 cerebral hemispheres. This corpus callosum has 4 parts. This is the rostrum, this is the genu, this is the body, and posteriorly this is the splenium. Now come to the pituitary. Here we can see this is the sella turci. Within it, this is the pituitary gland. Here we can see in the axial T1 weighted, here we can see this is the infundibulum of the pituitary gland, and in front there is optic chiasm here. Here we can see this is the eyeball. If we look at the T2 weighted axial image, here we can see this is the lens of the eye, this is the anterior chamber, and this one is the posterior chamber. Here we can see this is the optic nerve, comes backward and joins to form the optic chiasm just in front of the pituitary infundibulum. Here we can see this is the cerebral peduncle of midbrain. Here are some cisterns. This is the interpeduncular cistern, and posteriorly there is cisterna magna in this part. Here are the sphenoid sinus. In the sagittal section we can see this is the location of third ventricle here, and this is the location of fourth ventricle here. It is the cerebellum, you can see. This is the occipital lobe. This part is the parietal lobe, and this one is the frontal lobe of the cerebral hemisphere. Here we can see in the axial image, this one is the temporal lobe of the right cerebral hemisphere. This one is the temporal lobe of left cerebral hemisphere. So for understanding pathology, first of all we should know the anatomy very clearly. Here is the internal acoustic meatus. Here you can see the 7th and 8th cranial nerve enters through this internal acoustic meatus. Here are some important structures like cochlea and semicircular canals. Here we can see this is the prepontine cistern. These structures are very important for understanding pathology. Thanks for watching. Please subscribe our channel for getting more important videos like this. Hope we will come back again with new topics. Thank you very much.